Hello, dear friend. Today I will discuss pruning. This is a very delicate procedure, surgical. If you watch this video to the end today, you will find out who needs to do it, who doesn't need to do it, what the consequences can be, complications, and what doctors rarely talk about. The main misconception probably is that this is only done for religious beliefs. However, this is not true. There are medical indications, there are social indications. Well, let's try to figure out who really needs circumcision, and for this we will delve into the past. The first mentions of circumcision, they go far back to the pagans. Earlier, sacrifices were practiced, as you know, and over time, to avoid sacrifices, they began to cut off, so to speak, a small piece of a man to give to God, well, divinity, and keep the child healthy. Then, circumcision began to be practiced according to religious beliefs, by national characteristic. Circumcision is not always a religious belief. For example, Jews often perform circumcision, a large part, even if they are not religious, just to show their relationship to the people. That is, to be part of their people. As you know, Jews are most often circumcised people. Muslims often practice circumcision. There is even female circumcision. Yes, you heard right. There is female circumcision. What would there be to cut? They cut the labia, the large labia, the small labia. And there's even such a perverse practice of circumcision when the clitoris is removed. This is often practiced. It is practiced in Africa to make a woman get less pleasure from sexual relations, from sex, from coitus. And accordingly, she had no desire to change her spouse. Well, of course, it's a stupid reason in reality. But many are motivated by this and do it. This, of course, is a very tricky operation. And for many, this is also part of their religion. But this is mainly in African countries. But, as I heard, unfortunately, this is sometimes practiced in the Caucasus as well. Although a certain form of female circumcision, it is also considered plastic surgery. For example, labiaplasty. As you know, sometimes some women have labia that are too large. Plastic surgery makes them more visually appealing, as they believe. And those who are bothered by it actually do it. The principle is very similar to circumcision, which we will discuss now. We won't discuss religious matters. It's probably foolish. Every nation, every religion has the right to do this or not to do it, and to discuss it, well, not that it's foolish, it's unseemly and wrong. So we won't stop here. Let's talk, after all, about who needs to do it and why it needs to be done. One of the indicators is social indicators. Yes, you heard right, social. But what is such social significance? The thing is that the sensitivity of the penis, it can change after circumcision. Yes, circumcision is the medical term for cutting off. That is, cutting off the foreskin, correctly speaking, circumcision. And by the way, it doesn't bend. Yes, indeed. The sensitivity of the head, if the circumcision is done correctly, can change for the better. In other words, the length of sexual intercourse will keep getting longer. However, if the circumcision is performed properly, often people come to the reception and say, I want a circumcision. A 35-year-old man wanted a circumcision after living without one until that age. I ask why. And after questioning him from different angles, I understand that in reality, he wants to prolong his sexual act. And it's very important not to hide your true goals from your doctor, because the technique of circumcision, when we talk about the goal being to prolong the sexual act, is different. It really differs. If, of course, the specialist is competent in many ways, and in how much we remove, and what we do with the frenulum. It may even be worth doing a partial denervation of the head of the penis at one moment. The most important thing is to understand why you need this. First, prolongation, that is, extension of sexual intercourse. This is the first reason. The second reason, infections. Infections, skin changes, discharge that does not pass. Reactions can occur to partners, contraceptives, or condoms, in the form of skin lesions, rashes, redness, chafed skin. And any ointments, any antimicrobial agents, wound healing agents, they bring temporary effect. This is especially common, by the way, in people with diabetes. Applied it passed. Applied it passed. People just get tired and understand that having to live with this for a long time brings tremendous discomfort. And this is a medical indication. The subject should be treated as a medical indication. The narrowing is called phimosis. That is, when the head does not fully open or opens, but there is a narrowing ring. And this is actually not very good because, in addition to the fact that it may simply be uncomfortable for you to have sex, it is possible, or let's say it does not bother you, but paraphimosis can occur. What is paraphimosis? It's when there's a constricting narrow ring, the head is opened and got stuck, then it's swelled even more. And often before, when I was just working in emergency care, when I worked in the emergency hospital, men were brought in with huge swellings, with a purple head, with a severely swollen foreskin, and he couldn't close the head. And if such a head is not treated, it can even lead to necrosis of the head. This is not a joke, it's a very serious condition. And it's impossible to do this on your own at home because the outer layer is so strongly rejected and the head is so strongly rejected that it's impossible to fix it without surgery. Without cutting the ring, sometimes it's impossible. One of the reasons is the large excess of the outer layer, which really interferes with your sexual life. That is, there is no ring at all, but there is so much flesh that it becomes physically uncomfortable to have sex. Aesthetic considerations, someone thinks it's beautiful. They come and say that I think I like it, I want such hygienic considerations. Is there a point? There is a point. There are people who produce smegma very actively. Smegma is what the glands of the foreskin produce. And smegma, in fact, is not just something unpleasant or smelly. In some people, especially if there is phimosis, sometimes even stones, smegmaliths, form from these lumps of smegma. And when a man walks around for a long time with an unopened head and does not observe hygiene, when we perform surgery, open the head, there are even sometimes, imagine, smegmaliths embedded in the mucous membrane. And smegma, it's dangerous. Why is it dangerous? It's a risk of oncology, but not for the man, for his partner, for the woman. It is believed that for women over 30, if the partner is not circumcised, this is a risk of developing cervical cancer. In percentages, the figures now vary, so we won't specify. But the risks increase according to some statistics, even up to 30-40%. In some countries, according to studies, up to 70%. Therefore, it is extremely important, if you have such a feature, that a large amount of smegma, there is a lot of it, and no matter how well and often, 3-4 times a day, you do not wash the penis. It does not help. It is better for you if you do not abstain with a partner to get circumcised. Phimosis, yes, you all think that it is something congenital, and that it is necessarily a child who has been circumcised. No, that's not the case. Often it happens after trauma. A foreskin injury during sex could lead to improper stitching, resulting in scar tissue formation. This scar tissue may not stretch properly. The same thing, by the way, applies to the foreskin. If you tear the foreskin once and it was short, then it often tears over and over again. And then, even if you've been having sex for 20 years with a short foreskin, once you tear it, you start to injure it often because it stops stretching as it used to. Phimosis can be acquired and often occurs in people with diabetes. Sometimes in my practice, I found diabetes in people because they had phimosis. I mean, when did the phimosis appear? He says, around 45 years old. I see a pronounced phimosis, a narrowed foreskin. It doesn't reveal the head. I ask, have you checked for sugar? No. I'm sending to check the sugar, blood glucose, glycated hemoglobin to increase diabetes. Therefore, if you have developed polydipsia, whether it bothers you or not, but if it's excessive, please check your sugars, because this could be a sign of diabetes. This is a very dangerous, threatening condition. About diabetes, we will probably make a separate episode on how to initially detect it before you get to a competent endocrinologist who will already take care of your treatment. What signs you can find even without tests. We will definitely shoot a video about this. So set the bell, subscribe, and you will definitely be the first to watch this video. Is it possible to cure phimosis and get rid of the risks that you will have paraphimosis or any complications? In practice, I can say I had patients who practiced baths, stretching, warming ointments, and developed the extreme flesh. A ruble ring, it will always remain a ruble ring. And at 95, even I would say 99% of patients, this turns into the fact that as soon as they stop their practice of stretching this ring, it starts to narrow again. For most of you, phimosis, narrowing of the foreskin, will not resolve after the operation. Regarding the operation, what should you know? This operation is critical. Avoid treating it casually, like saying, Ravi had a circumcision, sprinkled salt on the wound, and everything is fine. A child's genitals are small, an adult man's are large, and unlike many plastic surgeries, your nose does not grow overnight, or, when aroused, your ears do not expand. Your face does not increase 3 to 4 times in size. Circumcision in a child and circumcision in an adult are fundamentally different, both in terms of execution technique, suturing technique, how it heals, and possible complications. In an adult, in a large penis, there are many arteries, many veins, such a thing as an erection, and therefore they can be bloody, they can heal poorly, especially if you are a patient with problematic sugars. You need to approach it wisely and go to a good specialist. This is a common operation on which young surgeons are gaining experience, and therefore they will often persuade you and tell you how simple it all is. But in reality, I often perform this operation even though I mainly deal with major surgery. These are 5, 6, 7-hour operations. But sometimes patients who have been poorly circumcised come to me and ask for help to somehow correct it. With foreskin, it's not all that simple. If too much is removed, you will have skin tension, and the penis will look, as I say, like a circus in Chapito. And there will be a visual shortening of the penis. If too much of the edge tissue is left, you will not get the full effect of the circumcision that you came for. There is prolongation of sexual act, extension, or a cosmetic aesthetic result that you are aiming for. Doing everything correctly in the right hands is extremely important. And the most important thing to remember is that, unlike a child, there are a lot of pitfalls here. There can be necrosis, there can be hematomas, there can be poor engraftment. Sometimes a repeat operation is required, somewhere the skin did not take. And the final appearance of the penis is achieved in 3 to 6 months. Initially, it appears unappealing. But if you've decided on this, I would probably recommend 2 basic pieces of advice. First, do this not with the big shots, but with people who do this a lot and often. Because if a person is focused on completely different operations, it doesn't mean that they will do this operation well and beautifully for you. If he removes their, I don't know, like I remove moles, and doesn't have constant work in contact with these small operations, he might not do it very beautifully either. Therefore, I do not recommend coming to me. God forbid, I recommend you to go to a good doctor in a state clinic. And do it there and with someone who does it often. Regarding children, I will tell the following. If you're listening to this about a child and wondering whether it's worth doing, remember that children have a physiological fear. That is, yes, there is a narrowing, but it will pass over time. And not everyone needs to be operated on right away. Sometimes it's worth waiting, let the child grow a little, let him develop so that the penis becomes a little bigger and it's easier to operate. There is a separate specialization, pediatric urology. And to operate with an adult doctor, with the one who performs operations on adults, a child, first of all, legally cannot. Secondly, it's not worth it. He will perform poorly. It's risky. Very frequent complications, you can't even imagine how, and these are the most terrible frames. It's like a mutilation at home. This is a home circumcision for children. You won't believe how often, along with the extreme skin, either part of the head is removed or the entire head. And the child is disabled. We are currently struggling with this, trying to do something with these underqualified surgeons, especially those who do this for religious beliefs. The child leads a troubled life filled with many complications. Therefore, I strongly advise you against doing this at home. Only in a clinic because complications can vary. My important advice is, if it's possible to do it with a child under local anesthesia, I still don't recommend local anesthesia for adults, because infiltration, that is, the introduction of an anesthetic, expands the penis so much that it won't hurt you. This will not allow you to adequately achieve a cosmetic effect, especially if the specialist is not highly skilled, because everything is swollen when the anesthesia wears off. When the anesthetic comes out, it might look a little bit not very beautiful, let's say. Therefore, it is definitely under anesthesia. It's 15, 20, 30 minutes. It's not worth it. It's a painful anesthesia, most likely. You'll be breathing on your own without a tube. I advise against doing it under local anesthesia. And I don't recommend, if you're going to talk to a doctor, to use what's called self-absorbing material, because in reality, it's self-rejecting. And if you're not using a classic stitch but a cosmetic one, it's better to use a regular thread that you'll simply remove in 10 to 12 days. The end result will be much better. If you want to make a cut to extend the half-life, it's advisable to completely remove the navel, because there are a lot of techniques for certain types of cuts. The frenulum is preserved. It's such an erogenous zone of yours. It's better to remove the frenulum if you want to extend the half-life. Under no circumstances should you try to perform circumcision yourself. It's much more complicated than you think. And I'm not joking. I've seen many who were rushed to the emergency room, who started trying to circumcise themselves with a razor, even did half the job, I would say. And realizing that it's bleeding heavily, that everything is not as simple as it seems, it's only in videos where tribes cut with a bamboo stick and everything seems so simple. Unfortunately, it's not that simple. And if you cut off too much and do it yourself, it certainly won't look nice. And sometimes, you even have to undergo several reconstructive plastic surgeries afterwards. I had a patient who twisted something at home, I think it was a stool, and imagine he had a particularly long foreskin, and he kept thinking, to cut or not to cut, to cut or not to cut. And imagine a piece of his foreskin got twisted around the stool from his family pants. The skin was removed from the entire penis. That is, it didn't just remove the foreskin, it removed it from the entire penis. And in the end, we performed the operation, sinking the penis inside the scrotum. Only the head was sticking out of the scrotum, and then after a certain time, when all this healed, they cut out the cloth and sewed up the penis. In the end, the penis was slightly hairy. He had to go for hair removal for a long time to remove the hair. By the way, a very important aspect. Circumcision will not save you from sexually transmitted infections under any circumstances. Don't think, many come and say, I don't want to suffer from sexually transmitted infections. Let's do circumcision now. Everything will pass. I say, where did you learn this? Where did you even read this? He says, on the internet. Yes, I read it. Really writes such a thing? It's complete nonsense. The classic sexually transmitted infections include mycoplasma, Gardnerella, and ureaplasma. For a kind soul they will fly in, you will get sick exactly the same way. So, if you think that you have been circumcised and then you can stop using contraceptives, this is not the case. Finally, what we will talk about is cancer. Does the risk of developing penile cancer decrease if a man is circumcised? Yes, it decreases, especially if a man has the human papillomavirus of the 16th, 17th type. These are oncogenic strains. The earlier the circumcision is performed, it is believed, the less chance there is that he may get sick. Therefore, if you already have the human papillomavirus, probably this is one of the reasons to consider circumcision. And probably you would like to share some interesting stories related to circumcision. Maybe you've heard of some alternative methods of treating phimosis, because I don't look at them myself, shamanic methods, I call them. But there's so much interesting stuff, it turns out, that they suggest how to treat the narrowing of the foreskin, how to treat phimosis. And since I am a supporter of classical medicine, I am very interested, really, if something from this actually works. If you have experience treating foreskin narrowing, please share. It will be an interesting read for many, including myself. I share many stories and surgical procedures on my surgical channel. You can see the link to it on my main Telegram channel. There you can also read about the what, why, and purpose. If you are interested in surgery, come in, read, subscribe. It will be interesting, I promise.